My name is Nana Donkor. I'm the Health Education Supervisor in Prince George's County Public Schools in Maryland.
And my name is Leah Jaspers. I'm the Specialist for Health Education at the Maryland State Department of Education. In Maryland, health education is required each year for students in grade pre-K through grade 8. Maryland high schoolers are transitioning from a half credit to a full credit, starting with the class of 2025. Health education includes 6 core concepts and 7 essential skills. One of those 6 core concepts in health education is mental and emotional health. Core concepts related to mental and emotional health include the exploration of emotions and feelings, relationships, self and social awareness, and emphasize health-seeking behaviors related to troublesome feelings of stress, anxiety, depression, or suicide. The goal of mental and emotional health education as part of comprehensive health education is to help young people in the acquisition and the application of knowledge, skills, and attitudes needed to develop healthy identities and personal agency.
As Leah mentioned, one of the former Maryland health education standards was mental and emotional health. And through this unit or this standard, students learned about mental well-being and ways to improve, support, or to seek help for their mental health and that of others. Now that we have moved to skills-based standards, students explore mental and emotional health concepts while practicing essential skills such as accessing valid and reliable information, analyzing influences, interpersonal communication, decision-making, goal-setting, advocacy, and self-management. In relation to mental and emotional health or mental health, students learn ways to communicate and advocate for the mental health needs of themselves and others, as well as ways to locate valid and reliable resources for mental health. Students should receive age-appropriate and grade-level specific health education instruction at every grade level that includes mental health education. Skills-based health education should be provided to students with opportunities for practicing the skills and demonstrating understanding of the skills as they pertain to mental health. In response to the pandemic, teachers have been asked to incorporate skills-based mental health education that emphasizes strategies for healthy coping and self-care, interpersonal communication, empathy, reducing mental health stigma, and finding creative and encouraging students to practice and learn of creative strategies for increasing connectedness during atypical times. They also provide instruction on ways students can locate resources and information that can be shared with families, also school staff, related to understanding the mental health impacts of COVID and strategies for healthy coping and promoting well-being. In Prince George's County Public Schools, I will say that teachers have been more intentional about noticing the mental well-being of their students just by simply asking students how they're feeling and being more considerate of their mental health needs.
It's essential to update health education curriculum to include discussions about COVID-19 and its impact on mental health at the individual and the group level. In an integrated tiered system of support, health education is a baseline or tier 1 intervention supporting student mental health. So an intervention that all students should receive. We're thrilled that the state is transitioning high school students to a full credit of health education. And it's really important that we are teaching health education yearly as required in the foundational pre-K to 8 years to support higher levels of knowledge and skill mastery.
Thank you for listening. We hope you find these recommendations for prioritizing health education to support mental health in your schools.